Okay, so now it's time to get back into the alimentary canal, and so we'll pick up from where we left off at the oral cavity. So we'll head into the pharynx. The pharynx is a common passageway for food, for liquid, for water, and so things can get confused in there, as anybody who's ever choked knows. The pharyngeal walls have two layers of skeletal muscle, so rather than being smooth muscle like much of the alimentary canal, we're seeing skeletal muscle here at the pharynx. The outer layer has longitudinal fibers. The deeper layer has circular fibers. These are called the pharyngeal constrictor muscles, and so it's peristaltic contractions of these pharyngeal constrictor muscles that force the food from the pharynx and downward into the esophagus as they squeeze, pulling inward. The swallowing process is known as deglutition, and it's the movement of food from the oral cavity down to the stomach. And it requires the coordinated activity of a number of muscles and organs in order to force food from the mouth down to the stomach. So 3 stages of the activity. The book does not label them as these stages, but it does describe the 3 stages. So we'll give them the 3 names: the buccal phase, and that's how you say that term. I think it's. In fact, I thought it was buccal cavity for the longest time, but the correct pronunciation, proper pronunciation, is buccal phase, the pharyngeal phase, and the esophageal phase. And you may remember back from chapter 1 that buccal refers to the mouth. So the first stage, the buccal phase, is under voluntary control, and it takes place in the mouth. And as we chew our food, it gets mixed with saliva and gets compacted into what's termed a bolus, a mass, or a ball of food material. And we use our tongue to force the bolus back toward the oropharynx. It's the portion of the pharynx that's closest to the mouth. So as we push it back toward the pharynx, that's the buccal phase. The next phase is the pharyngeal phase. So we push food into the pharynx, and that's when reflex action takes over. So once food gets forced into the pharynx, then every route out of the pharynx gets blocked, except for the route down in toward the esophagus. So the tongue blocks off the mouth. The soft palate rises, and as it rises, the uvula, remember we talked about the uvula, pushes upward, or it rises along with the soft palate rising, and as the uvula rises, it blocks off the nasopharynx, the portion of the pharynx that's associated with the nasal cavities. And then the larynx rises as well. The larynx is the voice box, and it rises, and as it rises, the epiglottis is able to lay down and cover most of the entrance into the respiratory passages. And then muscular contractions of the pharynx will take over. Very briefly, breathing is even inhibited so that we don't accidentally aspirate some of the food that's in that bolus. And the contractions of the pharynx help to push the food downward toward and posteriorly toward the esophagus. And then finally, the esophageal phase, also involuntary, and this is where the peristaltic contractions push the bolus from the pharynx into the esophagus and onward into the stomach. And it requires something like 4 to 8 seconds for the entire swallowing process to occur, to get food from the oropharynx down to the stomach. And then plop, the bolus of food lands in the stomach. The tube for getting the food from the pharynx to the stomach is the esophagus. It's a collapsible muscular tube found posterior to the trachea. So when we do our fetal pig dissection, we're going to see that the esophagus is, while the trachea is held open, there are rings of cartilage that hold it open. There are no rings of cartilage that hold the esophagus open. It lays flat. It's kind of just flops closed until a bolus of food passes through. So the esophagus runs from the pharynx through the connective tissue of the mediastinum. It passes through a small break in the diaphragm called the esophageal hiatus. If you think about what that term hiatus means, when a TV series goes on hiatus, it takes a break. So this is just an opening, a passageway that allows the esophagus through the diaphragm. And it's sealed. The diaphragm seals around the esophagus. It's attached to the esophagus. But if a rip occurs right there at the esophageal hiatus, that leads to a hiatal hernia as the stomach herniates. Hiatal, there's no I there, sorry about that. Hiatal hernia as the stomach herniates or pushes up into out of the abdominopelvic cavity and into the thoracic cavity. And the food so that bolus of food is pushed down toward the stomach by peristaltic contractions. And as the bolus of food reaches the lower esophageal sphincter, the sphincter will relax. That sphincter is a band of circular, smooth muscle. Should have fixed that. There at the inferior end of the esophagus. And it can very tightly seal off the contents of the stomach from flowing back into the esophagus. We talk about that as gastric reflux. Sorry. I'll try that again. Reflux. So gastric reflux is prevented by the lower esophageal sphincter. But as that lower esophageal sphincter, as it loses the ability to constrict as we age, or with eating a really large meal, it can't constrict as well, then that allows fluids from the stomach to reflux back to the esophagus. And the esophagus is nowhere near as protected from the acidic foods of the stomach as the stomach lining is, and so it can be damaged very easily. And it's sympathetic stimulation, fight or flight stimulation, that prevents the sphincter from opening, that keeps it closed. And parasympathetic stimulation that allows it to relax and lets the bolus of food pass into the stomach. The stomach has a number of functions. It mixes the food with the gastric juices that are produced by the stomach lining, and we'll talk about what's in those juices in just a minute. It can lead to more mechanical breakdown of the food. So as we begin some chemical digestion, it allows that softens up the food material, and then as the stomach does its mixing motions, then the rugae of the stomach can rub and further break down mechanically the food. It also is the place where we have the first round of protein digestion, thanks to the enzymes that are produced by the stomach lining. And then it can do a little bit of absorption. So we can absorb water, alcohol, so we don't have to wait to get our beer or alcoholic drinks into the intestine to absorb the alcohol. It starts to be absorbed almost immediately upon reaching the stomach. And some salts are also absorbed there. And it has the capacity of about a liter of material. Get much beyond that, and we start to feel really, really uncomfortable, and it stimulates movement of material out of the stomach and into the small intestine. So if we look at the stomach anatomy, this area, so this is the stomach, and here's the sphincter that closes it off. Here's the sphincter that closes it off. Okay, so this area that is up, I should have made it maybe a little bit bigger, this area here up above the lower esophageal sphincter is referred to as the fundus. We see the term fundus, we'll see it used a couple more times. The urinary bladder and the uterus both have a fundus as well. So the fundus is this region here above where the ureters bring urine into the urinary bladder, or if this is the uterus that we're looking at, then it's where the uterine tubes come in to meet the uterus. This area above those tubes is the fundus, so it's the same here with the stomach. This area here above the entrance into the stomach is referred to as the fundus. The area right around where where the esophagus dumps into the stomach is called the cardia. This region here is referred to as the pylorus, and the rest of it is the body of the stomach. So the body is the largest part of the stomach. The pylorus has the pyloric antrum, the entrance into the pylorus, the pyloric canal, and then the pyloric sphincter, which is the sphincter muscle that regulates the flow of food out of the stomach. This is the lesser curvature of the stomach. Here's the greater curvature of the stomach as well. Come on, stop. Curvatures. Lesser here, greater there. All right. So let's think about the stomach structure for a second. The inner layer of the stomach is circular, smooth muscle. The outer layer is longitudinal, smooth muscle. So again, although it's smooth muscle, it's the same arrangement as we see in the pharynx and in the intestine, with the outer layer being longitudinal, the inner layer being circular. But some portions of the stomach also have a third layer, an oblique layer, so that run at an angle somewhere between the right angle built by the circular and the smooth muscle. This provides additional strength to the stomach wall and more power in doing the mixing movements that we associate with the stomach. And again, the inner lining of the stomach is folded into rugae. These are rough wrinkles of the tissue, and that allows the stomach to stretch without ripping, and it also allows for more of that mechanical digestion as the rugae rub the food. Okay, so what are the secretions? What does gastric juice composed of? Well, let's first look at the cells that produce the gastric juices. There are gastric glands. The gastric glands include the parietal cells, the mucus cells, and the chief cells. So those are the three types of cells or gland cells that produce gastric juices. Parietal, remember, means wall. So these are all of them are found in the wall of the stomach. But what some of the names, how I think of the names and remember what they're doing, is that the chief cells provide the chief digestive stuff. The parietal cells are just there in the wall, and the mucus cells, of course, we're going to see that they secrete mucus. So the parietal cells produce hydrochloric acid, which really brings down the pH of stomach contents down to like 1.5, 2 or so. So we just completely overwhelm any of the buffering capacity of the food that we bring into the stomach by giving it a huge shot of hydrochloric acid. And this helps to sterilize stomach contents, denatures proteins, making them easier to digest. Parietal cells also produce a hormone known as intrinsic factor that will, when the food gets to the small intestine, help aid the absorption of vitamin B12, really stimulates B12 absorption. B12 is an important vitamin that can only be found in food. We can't produce vitamin B12. The mucus cells, as you would suspect, produce mucus. The mucus they produce is very alkaline, though, and it stays in contact with the stomach wall. So the mucus, as it's released, kind of coats the stomach wall, giving a good alkaline coating here to prevent the hydrogen ions that are out there released as we release hydrochloric acid from coming and damaging the protein of the stomach wall itself. So this alkaline acid can help neutralize those hydrogen ions, preventing any damage to the structures of the muscle wall back here behind that layer of mucus. The chief cells produce three materials: pepsinogen, gastric lipase, and intrinsic factor. Pepsinogen is not an active enzyme when it's made, but once it's released, secreted out into the stomach contents, and comes in contact with the low pH fluids of the stomach, it denatures, it changes its shape, and becomes the active enzyme pepsin that will start protein digestion. So pepsinogen, remember, gen means the first or the beginning. So it's the beginning for pepsin. And when it's released into the stomach acidic environment, then it gets converted to pepsin, and it actually has an enzymatic effect. Why would it be that we would go to all the trouble of secreting this inactive form of pepsin? Think about the contents of the construction of a cell membrane. If the cell was producing an active enzyme, what would it do to the proteins that are trying to, in the cell, in the membranes that are wrapping around it, enclosing it? It would digest those proteins. So we can't produce an active enzyme. We have to have some other trigger, like hydrochloric acid, that will activate that inactive protein and make it into the enzyme that can actually then go about digesting proteins. Gastric lipase is another of the enzymes produced by the stomach, by the chief cells. Gastric, because that's where it's produced, in the stomach. Lipase, that describes the action of this enzyme. Ase means that it's an enzyme. That ASE suffix tells us it's an enzyme. The lip, that means it's an enzyme that digests lipids. And gastric lipase specifically digests butterfat, the fat that we find in milk, not any of the plant oils that we might be using in our cooking, but just butterfat. And then the chief cells also produce some intrinsic factor, again, which is all about aiding the absorption of vitamin B12. So how do we regulate the stomach secretions? What is it that we, how do we tell the stomach when it's time to produce stomach secretions? Well, there are three stages to regulation of stomach secretions. The cephalic phase is the first one. And the cephalic phase, what does ceph mean? It means head. So this phase occurs before any food gets into the stomach. It's stimulated by just thinking about food, smelling food, or tasting food in the mouth. So the cephalic, or the head phase, it all is pre-food entering into the stomach. So before we're even hungry or thinking about food, when the stomach has been emptied of its contents, it's no longer digesting the last meal, but before we've started getting hungry for the next meal, when a stomach is at rest, the cells produce a hormone called somatostatin. Soma meaning body, statin meaning just kind of being at the same standing in this stage, and somatostatin, when the glands of the stomach encounter somatostatin, they stop secretion. So it inhibits the secretion of the chief cells of the parietal cells of the mucus cells. So this is keeping the stomach from producing acids or producing enzymes that it doesn't need to be producing at that moment. But as we think about food, as we smell food, as we see the food set out on the table, then parasympathetic stimulation from the brain will inhibit the release of somatostatin. So we stop producing somatostatin. And in turn, then the gastric glands begin to produce acid, gastric lipase, pepsinogen, and intrinsic factor, and the acidic or the alkaline mucus. So we begin to secrete during the cephalic stage as parasympathetic stimulation reduces somatostatin production. The next phase occurs as food enters the stomach. So putting food in the stomach begins to stretch the stomach wall, and just the presence of the food there stimulates the release of a hormone called gastrin. And as gastrin releases, then the gastric glands produce even more of their enzymes, acids, intrinsic factor, and mucus. As the pH of the stomach decreases, the lower and lower pH provides negative feedback on the production of the hormone gastrin. So low pHs will slow the release of gastrin, which then slows the release of the digestive glands, so that by the time we get down to a pH of about 1.5, then no more gastrin is being produced. So we stop producing the stomach secretions once we have sufficient amount in there. And gastrin is what tells us that we are done needing to secrete. When we stop secreting gastrin, then we completely reduce or very much reduce the production of by the stomach glands. And then the third phase is called the intestinal phase. As food reaches the intestines, then a couple of things happen. First, we see the release of intestinal gastrin. So that stimulates I don't think it's gastric gland secretions. I'm sorry, I think that should say intestinal gland secretions. Let's just make sure. Intestinal phase. Okay, I'm looking at intestinal phase. Oh, okay, I'm sorry. That very briefly stimulates one last round of gastric gland secretions. So yes, we get a brief enhancement of gastric gland secretion thanks to intestinal gastrin. But as the acids, that acidic material enters the intestine, then we see sympathetic stimulation of the gastric glands, which shuts down their production. So we see complete inhibition of the gastric glands. Fats entering into the intestine trigger the release of intestinal somatostatin, which also provides feedback on the gastric glands and slows them down. So between the sympathetic stimulation and the production of somatostatin from the intestines, then we see the gastric glands shut down. Then finally, as the proteins and the fats that are entering the intestine, they cause the release of another hormone called cholecystokinin, and that will slow down all the movements of the stomach, so that we stop all the mixing movements of the stomach and kind of really slow the action there at the stomach. So, what does the stomach do? It does a minor amount of absorption. We've already mentioned this. Gets some water absorbed out of the food contents. Some salts come along with the water. Alcohol is also absorbed. And some lipid-soluble drugs are able to make it across the stomach wall and into the blood. All this mixing of the food with the gastric secretions, the breaking down into smaller and smaller bits, the chemical digestion, forms this soupy, thick, very acidic mixture that's called chyme. I know it's very tempting to want to refer to that as chyme, but if you look at the pronunciation guide in the book, it's K long I-M, chyme, and this is just, that you've had experience with chyme. If you've ever thrown up, and I think all of us probably have, then what we're throwing up is this chyme